Okay, hi everyone and welcome to Making a Difference, Confidence and Compliance in Healthcare Patient Service. We're going to have a nice conversation about healthcare QA today, but before we start, I have some housekeeping to do. So if you're listening well, don't worry about your connection. You're just fine, but if you can't hear me well or if your connection is oscillating, you can also dial in via phone, and this is how you can do it. Second of all, we are going to have a nice Q&A here today with Mary May from Relate Care, and you might come up with some doubts. You can ask anything you want. Just go in the question poll and questions. We're going to have time for a Q&A after the session. And last but not least, this session is being recorded, so if you need to leave early or if you feel that someone should be watching this but they could not for some reason, don't worry. Just make sure to register or make sure they are registered in the webinar, and they will receive a recorded version and presentations later. Okay, so let's talk about our agenda today. Today we're talking about three main topics. The first one is recruitment and the key competencies for patient service representatives. Second one is coaching, and the third one is QA and how to design a good program for it. Okay, and then of course we have our Q&A. Okay, so James, I'll hand over to you.
Thank you very much, Mariana. Hi, everybody. Thank you so much for joining us and welcome to Scorebuddy's latest webinar. My name is James Boyle, and this week, as Mariana mentioned, we'll be looking at inspiring confidence and compliance in healthcare customer service. So we are extremely lucky to be joined today by Mary May from Relate Care. So Mary May, without further ado, could you please introduce yourself to the group?
Certainly. Hello, everyone. My name is Mary May. I'm the Group Director of Quality Assurance for Relate Care. We are an Irish company that operates primarily working with US hospital systems right across America in many different facets. My responsibility is quality assurance, but we also do consultancy. We also do BPO outsourcing, workforce management, that type of thing. So delighted to join today and happy to answer any questions you may have.
Thank you very much, Mary May, and I'm sure everyone will agree we couldn't have anybody better placed to provide an expert view on the topics that we'll be covering today. So yeah, let's get started. So I guess many of the causes of healthcare worker attrition are related to the stressful nature of the healthcare work industry. And with that in mind, I'd like to invite you all to take part in our first poll and tell us, what do you look for in a patient service representative?
Okay, I think we have a good number. I'm closing the poll now and launching the results.
Brilliant, brilliant. So thank you everybody for taking part, and some really interesting numbers there. And we can see empathy and communication skills are without a doubt important skills that are always relied upon. And big jump jumping out there is resilience as well, and organizational skills. Really, really interesting. So thank you all so much for that. And I guess with that in mind, Mary, how would your own opinions be shaped on that? You know, areas such as resilience being very important when looking at recruiting patient services representatives.
Absolutely. I mean, all of the elements that you've listed there are very important. The other thing I probably would have added in is, and perhaps that comes under or is related to organizational skills and emotional intelligence, are the hard skills. When you're scheduling using whatever platform you're using, whether it's Epic in the hospital systems, the actual knowledge to be able to navigate correctly, to schedule correctly in line with what the protocols are is absolutely crucial, because it can lead to potential roadblocks. You can schedule an appointment, you can have a fantastic interaction, great communication skills, empathy, understanding, positive reflection of the hospital system. But if the patient gets to the clinic and there's a roadblock because it's been incorrectly scheduled, then that's a negative impact. It means that whilst they may have had a great experience with you, if it doesn't follow through at the clinic, if the insurance, for example, hasn't been checked, and they get to the clinic and all of a sudden the insurance has lapsed or it's not one that's accepted, then that whole patient experience is more negative. The important part of that is 92% of referrals come from word of mouth. So most hospital systems, the referrals are made by their patients to other potential patients. I think the hard skills is one. Empathy, understanding, and definitely the communication skill is crucial, because it's all about language. It's all about the patient feeling acknowledged, feeling valued as part of the hospital system family. You want to retain them, you want to retain them, you want to keep them for a long time. So each one of those skills, definitely hard skills for me, but also the communication and empathy is crucial. Resilience, of course, I saw 67% of that. That's really important too. Contact centers, by their very nature, I think we all know what they're like. So you do need that resilience, because most agents may not have the same oomph at 3 o'clock in the afternoon that they had at 9 o'clock in the morning. So it's the resilience to be able to plow through, facilitate patient access, represent the hospital system effectively, and schedule correctly.
Yeah, of course. And they can be tough competencies to, I guess, get an analyze, get a feel for upon first meetings during the actual recruitment process. So, I guess, Mary, how do you approach the recruitment of patient service representatives to, I guess, get a feel for, does somebody you're speaking to hold those key competencies?
Before COVID, I think it was a lot easier because they were in person, and it's very easy. I mean, we do video meetings. It's much easier in the room when you're face to face to get a better understanding of the person that's sitting in front of you. The resume is one thing that you will receive. However, we do assessments. So we would do an assessment first. I know they do it in our recruitment department as well. From a QA perspective, I always do an assessment, because then you see what their capabilities are. We would also do things like navigating, basic navigating in terms of Microsoft Office. Do they know how to log in? Do they know how to troubleshoot? A serious amount of time can be lost if you've got an agent who is not proficient in that. It can actually slow the whole process down. And if they're not able to navigate successfully, that increases the average handling time, which in turn, causes an issue, because it means that they're not able to provide patient access for more patients calling in because they're stuck on this call because they don't know how to navigate. So initially there would be assessments it would follow on then from onto the interview. After that, once the assessment is complete, we have an opportunity to review the results. And there are specific questions that you can ask. Are you able to work on your own initiative, which is very important in a contact center. Always essential to have that backup with the supervisor, but the ability to be able to navigate and fly solo is really important. The resilience is really important because, and for some reason, it seems to have gotten a little bit worse since COVID. People tend to be very impatient. If they don't get what they want and they're not getting it immediately, they can get quite upset. And then 9 times out of 10, particularly with hospital systems, you're dealing with someone who is sick or a member of their family is sick. They're not at their best. And sometimes that comes through on the phone call. So it is that emotional intelligence and understanding. The other thing that they call it critical thinking these days, it used to be known as common sense. That common sense approach to it is the empathy and understanding of what this person is
Yeah.
going through. Patients always want to feel acknowledged, that you acknowledge them, acknowledge what they're going through, understand, or use language to empathize with them is equally important. So we have specific questions that we would use to try and elicit that. We do scenario-based sessions where our quality assurance department is involved with the actual recruitment, where we would come in and run scenarios and then try and capture what the output is. And that usually gives a really good indicator as to whether this person is going to be able to do what you need them to do, and in a positive way.
Brilliant, brilliant. It's very interesting that you mentioned it. Of course, the hard skills are so important because the communication lines have to be running at a very high level. There can't be misinformation, as you said, but the importance for those soft skills, as you know, in terms of one, empathy, it's going to be so important with the industry you're in. But that area of resilience that you mentioned, is that an area where you're finding, you mentioned it's tougher since the pandemic? Is that an area that's increasing as a challenge for you?
It can be a challenge, that resilience, because nobody likes to be shouted at. A lot of the coaching that I do, you know, if most contact centers have a problem child, so we would do emphasize coaching with them, get a measure of them. You know, the other thing is, whilst you're supposed to leave your personal life at the door when you come through, let's be realistic. It does impact. You could have a day where somebody is shouting blue murder at you, and because you're doing well yourself that day, it goes right over your head and you're able to deal with it. If you're not feeling up to it, if you're not feeling good, if there's something going on in your private life, then that will actually impact how you take it, how it's perceived. I always try and tell agents, I know it feels personal, it's not.
Yeah.
But it's the ability to be able to distinguish with that, to see past that, and to be able to engage and demonstrate that understanding. And it's not unusual that you'll have somebody come on the call who will give you their life history in the first 5 minutes. They're extremely irate, usually because they're sick or a family member is. And if you're calm and measured and use positive language and understanding language with them, it is not unusual that by the end of the call they will turn around and say, thank you so much, I'm so sorry I was horrible earlier, this is really tough for me. Instinctively, as humans, we tend to go negative. You have somebody who calls and says, I really need an appointment and I need it Tuesday at 10:30, and the representative is looking at the schedule and they think, this is not happening, there's no availability. So now they've got to go back and deliver the difficult message. How do they do that? Instinctively, as humans, we go back and we say, well, unfortunately, the worst word that you could use, because straight away they know they're not getting what they want. So it's flipping that. It's not what you can't do, it's what you can do. So I've checked the schedule and I see there is no availability that day. However, I can offer you the same time the next day. It's not ideal, it's not what they want, but it is a positive approach that usually results in a more positive outcome.
Yeah, totally agreed, Marion. From what you were saying, in terms of being able to identify that early during the recruitment phase, is going to really be a benefit to both the team and also the patients themselves as you move forward.
And the role plays, you know, we do role plays as well, which are actually very important, because that really gives you an insight into how people would cope.
Brilliant. I totally agree. And it's funny you touched on coaching, which is a great segue into another area we wanted to discuss today, because coaching plays a significant role in many settings, but especially healthcare, where well-being, empowerment, and performance are absolutely essential. So this is an area we want to touch on and have a bit more of a discussion on this with you, Mary. But first, let's get a sense from the audience, how frequently is coaching carried out across your team? So Mariana will open the poll now. So similarly to our last topic, if the audience could please provide feedback on how often you coach your patient service representatives.
So anyone wants to vote this time? Closing. And here are the results.
Brilliant, brilliant. Thank you, Mariana. As you can see, quite an even spread. Couldn't get more even if we'd asked for. Mary, what are your thoughts on that? Do you have a view for the frequency of how much you feel coaching is best suited to patient service representatives?
Usually the engagement, the level of engagement with agents is extremely important, probably even more so now because of the remote nature of working. But also if you capture somebody through recruitment and you do want to retain them, the engagement is that opportunity where you get to know them, where there are those regular touch points. How we do it is usually through the QA process. So for example, if you're doing, it varies from organization to organization. We usually align ourselves with the industry standard, COPC, the Customer Operations Performance Center, as to what their recommendations are for best practice. If an evaluation is completed, we have a time limit. If it's on or above target, it can be fed back within 48 hours. If it's below target, 24 hours. And if it's a compliance, as in a HIPAA fail, it must be fed back immediately because you need to change that behavior. But it can be 5 or 10 minutes. It's really important to engage with them. Really important to acknowledge the successful things that they have done, but also drawing their focus, because if this is done throughout the month, it's the checks and balances to help improve that behavior. And then all of those results, in addition to their productivity, if they have tardiness, all those things, what their average handling time, can be scooped up and actually addressed in the monthly one-to-one, which is crucial. It's that 20-30 minutes that the supervisor will have specifically with that representative. It gives them an opportunity to get to know them, but it also gives the representative an opportunity to voice any concerns that they may have. They can set realistic goals for improvement that will be checked again at the following one-to-one in the following month, but it will also give them an opportunity to identify any additional coaching that they will need, because they're having this individual conversation. Perfect opportunity for representatives to say, you know what, I'm really not sure about this. Let's get some, the supervisor can get some refresher training or do side-by-side shadowing with a senior representative who has all the knowledge, and watch them in action, and then they're able to absorb that more positive approach to the work. The interaction and the engagement in particular is crucial, because it's going to make the representative feel acknowledged. It also holds them accountable, which is very, very important. And they're setting realistic objectives month on month, which is, if you set it 1 month and it improves, then you're able to celebrate it the following month. It's all about acknowledgement.
Brilliant. I guess on that, Mary, it's interesting that you mentioned the different levels of, you're mentioning that your coaching is interlinked with the QA process, as most are. And if there's been a compliance failure, for example, you'd want to address that immediately. So is your approach to coaching, is that quite a fluid method that you would take, and that various coaching methods that you would use depending on the patient service representative you're working with, depending on how they're performing that week or that month? Like, do you have a set method that you would run your coaching sessions on with the team?
It would usually it would usually be in the form of sitting with them, asking them what challenges they're feeling. If there's anything that they're unsure about, we would listen to a number of their calls. We would provide them. Really, the most important thing is to deflect the ownership onto them. It's not that you're kind of leaving them hanging, you're not, but to say to them, what do you think about that call? How do you think you did? What do you think you could improve? if they actually engage to that level and come up with the resolution themselves, they're more likely to absorb it and own it going forward. Usually if we have new agents, if they start within the first 30 days, we would do consistent coaching documents where we would listen to their call, schedule time with them, and then provide them the feedback. With the expectation that once the first 30 days is over, they've had an opportunity to embed the process in what they're doing every day. We've provided additional coaching, and after 30 days, their scores would become fully accountable then for their performance management from then on. It usually takes, any new process being realistic, it usually takes about 90 days for it to fully embed, for them to be completely comfortable, fully familiar.
Yeah.
You can go through all the training, you can do the hard skills training, the soft skills training, and then it comes to that moment where they take their first call, and it's nerve-wracking for them. So the more support that you can provide with them, we actually operate what we call a graduation bay when they come out of training, and we spend that period of time with them, listening to their calls, doing sample calls with them, coaching them side by side. Obviously, if they're remote, we shadow online. But it is crucial to instill that level of confidence in what they're doing. And it makes them feel good about themselves.
Yeah.
They're more likely to be confident and positive as a result of that.
Yeah, which is so important, especially when dealing with the healthcare industry. And as you said, callers who will be at times be irate or will be in a difficult position. So the confidence of your PSRs is going to be so important.
Well, it is, and it also reflects well on the health system.
Yeah.
That's what you want. If you're sick or a member of your family is sick and you're calling, there's an uncertainty there. So the more confidence your representatives can demonstrate, the more confidence they are going to have in the hospital system or the healthcare system, and the more positive feedback that you're going to get at the end of the day.
Yeah, I couldn't agree more. And well, one thing you mentioned, Mary, was in terms of how you approach your coaching, it's based on those levels of engagement you're having with PSRs. And let's be honest, in most cases, levels of engagement are high with the team. Everybody wants to work towards their own improvement and improvement for the health system as well. But what would you do when faced with a challenge when maybe a PSR isn't as engaged?
You set realistic expectations. This is where the performance management process comes into play. The feedback, the intermittent feedback that happens throughout the month, the monthly one-to-ones, having the data, the metrics for what their performance was, is setting realistic expectations. It is unfortunate that on some cases, you're not seeing an improvement. They're still not engaging. Performance improvement plans sometimes do help, where you sit down with them, you work out what the PIP criteria are, and you check every 2 weeks usually as to whether they're meeting, whether you're seeing that level of improvement. Sometimes that is all that's needed to turn it around. They get it. If they don't get it, unfortunately, you can't have that person continue down the same path, because it turns out negatively for the overall team, but it also turns out negatively for the health system. So there are occasions where you do have to move through the performance improvement plan, corrective action, and march them out the door. But it's not as, I know it sounds cold, it's not as simple as that. You do provide the coaching and support in the meantime. It's only if all else fails.
Yeah, of course. And I guess in your own view, is that something that has rapidly evolved, especially in the healthcare industry since the introduction of more common remote working since the pandemic?
We've always had it. We've had to change it slightly, obviously, with the amount of remote working that's going on. But the potential risk means that you have to be very focused in your performance management approach, because you're talking about patient health information. Think about it. If you look at a medical record, it has everything in there, right down to usually the patient's social security number. Everything that relates to them, to their identity and demographics, is contained in the what we call the MRN. You cannot have any breaches of that, especially in this day and age where data is everything.
Yeah. Oh, it's a new factor to bring in to what was already a heavy regulated industry for you.
Yeah.
Yeah. No, it's really interesting, you know, in terms of your approach, I guess, to just coaching the team and having that, in some ways, fluid approach that some people will need a more regular cadence of sessions, and especially, of course, new hires.
Some of them are going to need a little more hand-holding than others.
Yeah.
Some of them will fly. But I think I mentioned this earlier. This is a great opportunity to sit them with your more senior agents, because they can absorb the correct way of doing what they need to do if they see it done. It does impact. It does have an impact. It is worth it.
Brilliant. And it's funny because you mentioned how coaching is intrinsically interlinked with QA.
It is.
Because QA will provide that feedback to help, I guess, target your coaching plans for the team.
Well, I think from the quality assurance has to go hand in hand for me, and I know I'm biased. I think it's the cornerstone of every contact center. The support that it can provide to the operational team is crucial, and the better the relationship that there is, if they're seeing each other as partners, that's going to be a win-win, because that will reflect down to the representatives. They'll be able to see that there is this partnership, there is this support, which means that they're, agents can be funny sometimes, representatives can be funny. They're not above. Sometimes I do say that they're like kindergarten, where they're not above pitching one against the other. Do you know what I mean? They'll perhaps go to QA and say, well, I don't think you're doing it right. And then they go to the supervisor with a completely different story. The more united approach, and if a quality process is going to work in any business, the impact has to come from the top down. The ownership has to come from the top down. The expectations have to be set.
Yeah, couldn't agree more, mate. Couldn't agree more. I guess in terms of the QA process, how did you approach the design of your own QA program?
I tend to, usually because I work with different health systems, I schedule design sessions with them. So we would sit down, I would potentially put a draft scorecard together based on my experience of what the necessary elements may be. It's a little bit like a smorgasbord. It's got everything in it. And then by liaising and by engaging with the hospital system, they'll provide you what their business requirements are, what are the hard stops. HIPAAs, obviously, insurance is another one. What kind of things with COVID, of course, and there was no in-person visits, there was a huge surge in my chart, the patient portals, where the patients can go on, log in, see their test results, perhaps have a video visit or have a telehealth visit, which helped the hospitals continue to generate revenue when they weren't able to do surgeries, procedures, or in-person visits. So it will vary from organization to organization. There's a couple of core things. Branding is obviously one, how you open the call, how you close the call. The HIPAA compliance obviously is crucial. Insurance in US hospital systems as well is equally important. And then there's, nice to have things as well. The most important thing is that for any medical record that is created, perhaps for a new patient who's registering, is that all the fields within that MRN are complete. The more complete MRN that you have, the easier it's going to be in terms of communication, being prepared, do they need an interpreter, that type of things. But the business requirements will vary from hospital system to hospital system. The core ones are usually there.
Yeah, of course. And earlier you mentioned the COPC best practice guidelines. Is that
Right.
something you take into consideration when designing out your QA programs?
Yes, they update their guidelines usually every year, sometimes every 9 months. And I usually try and keep an alignment with them where possible. At the end of the day, they don't necessarily go into that level of detail that the client would be able to, the hospital system would be able to provide you with in terms of what they need on a day-to-day basis. The other thing that we can do is look at how it changes, how the business needs change. Like I said, with COVID, my chart all of a sudden was a big push. The focus that I've seen with a lot of the hospital systems I work with over the last probably 6 or 7 months is focus on making sure that the demographics are correct and up to date. The communication between the health system and the patient is very important for appointment text reminders, correct contact numbers, both home and cell. I'm not sure how many people have home phone numbers anymore. Everybody seems to have switched to cell numbers, but making sure that it's up to date, because that then means that the patient is going to be informed on a regular basis. It also means that you're probably going to reduce the amount of no-shows to actual appointments, which in turn can flip the provider's schedule and throw it out the window. If you've got no-shows, it's not ideal for any hospital system.
Yeah, of course. And you mentioned, Mary, how business requirements are constantly evolving, but that has accelerated over the last 3 years. But of course, another thing that's constantly evolving is the regulatory landscape.
Right.
How has that affected how you design your QA process, and how do you stay on top of that to ensure the QA processes you're working on will cover your regulatory requirements?
I guess I do my research. I watch very closely what's happening. There was a period where I think it was back in February, all of a sudden it became a requirement, I'm in Ohio, that the patient must be provided with an estimate of what the likely services are. If it's a mammogram, if it's a procedure, if it's a surgery, they have to be informed of the likely costs in advance. That became a new regulation. So we were able to incorporate that into, were they advising of a copay? Were they advising of what the actual cost of this procedure is going to be, so that there's no surprises? And that in turn ties in with the whole scheduling piece. The last thing you want when you're scheduling an appointment is to have a roadblock by the time the patient gets to the clinic, which is why the scheduling process is a great way to capture everything. Make sure I always include what I call a recap at the prior to the closing of the call. The reason being, you can schedule an appointment, guarantee you by the time you get to the end of the call, they'll have forgotten 50% of it. It's reconfirming. And, you know, if you've got elderly patients who are calling and saying to them, you know, would you like to grab a pen and paper and write it down just so that you have it? Younger people and some middle-aged people, you can actually say to them, we will send you a text message, but the details will actually be available in your MyChart or patient portal. And that may be their preference. It's being responsive to what your patient population is. Having those options open for them. If they want to take it down, that's fine. If they want to access the patient portal, if they prefer a text message or an email, is being able to respond to that communication path for them.
Of course, and with, I guess, a regulatory landscape that, you know, it has its changes as they always do. How do you ensure the team are constantly upskilled and are moving with that evolution of regulations?
We hold internal calibrations on a regular basis, minimally once a month, sometimes every 2 weeks if we have the opportunity. At a time when there's a change, is particularly recently with the SOGI legislation that's been brought in, the sexual orientation and gender identity, has to be handled very sensitively. Some people can decline to answer, but all this data is being captured to make sure that when they come to the clinic, everything is correct, they're being addressed in the correct manner. Where we have introduction of regulatory change like that, we would actually up the number of internal calibrations that we do. The one thing that works really well for my team, I can say, is we actually have a Teams chat. And the one thing I love to see is the interaction between them all, where they may say, I'm listening to a call, I think I'm missing something. Can you have a listen to it with me? And they're calibrating constantly as they go along. And then we'll have the
Brilliant.
usually more formal calibrations once a month. It's important that there is consistency. It has to be consistent in the approach, in the marking. It has to be fair to the agents, because otherwise they just look at it as a punitive exercise.
Of course. And I guess following on from those calibrations, the constant calibration that you mentioned and that's running with the team themselves, does that have a material impact then on coaching and training of the patient service representatives themselves?
Usually, because what we would do is we would support the operational team for any new legislation that's been implemented. The other thing that I like to do is, if I design a scorecard, once it's agreed and signed off and it's ready to go into production, I design what I call a call flow, which is the supporting document, which is reflective of the scorecard, but actually it's twofold. It gives them indicators and suggested language that they can use, but more importantly, it sets out the flow of the call, which will get them to an ideal average handling time, so that they're not doing the branding and then going to the insurance and then back to something else, that it actually streamlines the call flow, how you want the flow of the call to go. And it's giving them little indicators along the way as to phrasing that they can use, information that they need to capture, acknowledging the patient, all those things.
It's brilliant. And look, it's really interesting advice as well for other people when looking at, designing the QA program, ensuring that the regulatory compliance measures are being covered. And
Right.
lots of that call flow will help, as you touched on earlier, in terms of both the hard skills, but also indicators with running calls in line with kind of soft skill guidelines as well,
Right.
in terms of empathy and critical thinking.
Well, also, it's all about language.
Yeah.
I say this, but it is all about language. It's all about the language that you use. The hard skills are so important, especially for correct scheduling, but how you engage and the language that you use to acknowledge the patient and demonstrate that understanding and empathy is equally important.
Most definitely, Marion. Thank you for that. And I guess we're going to open up our third poll of the day. And we'd love to get some feedback from the audience on, did you have any industry regulatory guidelines to adhere to in guiding and putting together your own QA program? So Mariana will open that now, and we'll keep that open to for a couple of seconds for everyone to give their feedback on this
one. Okay, I'm closing in 5 seconds, so 5 seconds left to vote. And it's closed. Here are the results.
So I guess not too many surprises there, and that there's not a single no coming through on this one, Mary. And that, as we know, there's such heavy regulatory guidelines in place in the healthcare industry, can vary, as you mentioned, from state to state. It's one that's going to be a huge cornerstone in designing out any QA programs.
It is because of, as I said, patient health information. The data that's contained in there is extremely sensitive. It was something that I experienced at the time, and it's a good number of years ago now in California. I was a leading hospital system that is one of my clients, and there was a separation situation. It was a pediatric hospital, and you would like to think that parents would behave in the best way, especially when it comes to their children, but not necessarily. The wife had left I think it was an abusive situation. The husband called, he hadn't been removed as an emergency contact. He got details of the appointment and turned up. And of course, there was a whole melee after that. So I guess the security of the information is crucial. There are very few industries right now that don't have some sort of regulatory guidelines. It's usually set out by the government by law, and is crucial in protecting people's data.
Most definitely, especially at times you said data is king, as such, as you mentioned earlier, Mary.
Yes.
Yeah,
it is.
Yeah, most definitely. So thank you very much for your input on that, everybody, because look, some really interesting insights into the designing of QA programs for the healthcare industry. One thing we wanted to touch on, I mean, in addition to the agenda Mariana set out earlier, 2023 is well underway, and I can't believe we're actually well into the second half of the year. That's kind of just flown by in a blink. What we want to do is have a little review of the year and see what's worked well for you so far in 23 and what you're excited about for the remainder of the year. So what I'd like to invite everybody to do, as Mary May is giving her feedback on this, is actually feel free to share your thoughts on what's worked well for yourself in 2023, what you're excited about for the rest of the year. Put them into the chat function that's available. We'd love to get your feedback on this and discuss that in a bit more detail. But I guess, Mary, how's 2023 been for you so far? And yeah, what are you looking forward to for the rest of the year?
2023 has been good. I actually feel that we've emerged from the craziness that was COVID, where we can get back to some level of consistency. As I said, when COVID hit, obviously we remoted all our staff for obvious reasons. What I really like most about now is the opportunity to bring, on a rotational basis, people back into the office. What I found personally with my team, you know, most people took to it like a duck to water. In the beginning, it was fantastic, but the lack of socialization, I think, had a negative impact without people realizing it. How much they missed that interaction that they would have with their colleagues every day. So what's worked really well for us is on a rotational basis, 1-2 days a week, they come into the office and we have kind of we try and coordinate it to have them in on different days. Not least because was a number of the representatives are remote, we do still have a presence in our contact center. I always like QA to be visible. Because it partners with the operational team, I always like a visibility on the ground there. I think it does help. It also helps with the interaction as they get to know each other. It's really important.
Of course. Now, have you seen, I guess, a change in terms of engagement levels between the team themselves, or even the team working with as you said, the operational side of the business?
Only in the sense that obviously in the beginning, say for last year, it was actually quite fraught at times because we were trying to still absorbing the whole remote aspect.
Yeah, of course.
And changing how we performance manage and how we support. We had to kind of think outside the box and think about better ways to be able to do it. What I really like about now is how happy they are on the days that they come into the office. They have the best of both worlds. They're engaging with each other, but they're also engaging with the operations team. They're there to answer questions which are always being posed. But then they get the couple of days at home where they work remote as well. So I like the hybrid approach. I think it works very well.
It's brilliant. It's brilliant because I guess pre-pandemic, a hybrid approach, having people work from home probably would have been a scary thought.
Absolutely. Contact centers by their very nature are to a certain extent micromanaged. Do you know what I mean?
Yeah.
The one thing that we found actually that works well is that our training is always on site in person, because you need to give them a sense of the company if they're new hires, but you need to ensure and assess them as they go through the various stages of training, their capabilities, are they able to progress, that type of thing, troubleshoot any problems that arise. But also we look at it in terms of, you know, you do get to go home, you get to work remotely. But if we're seeing a dip in any of your metrics,
Yeah.
come back to the office and reskill and you and all that before able to flex. So again, you're protecting your business, you're protecting your patients, which is really important.
Yeah, it really is. It's absolutely vital to have, I guess, that level of control still in place. But I guess that's a great thing. 2023, as you said, has brought back that sense of normality in some senses.
Yeah.
And I guess we look forward to
for sure.
the second half of the year now. Mary, is there anything that you're excited about if it's kind of further on in towards the end of this year or early 2024?
I guess one of the things that I've been looking at and researching is speech analytics, AI, and seeing how that can be utilized. Because remember, with AI, if you're doing, like, we have a concierge approach, a boutique approach, where, you know, we're live listening and evaluating at the same time. What AI can bring to the equation is the ability to evaluate a whole, like every call that comes in, that tranche. There obviously has to be a lot of work in the background in building the scorecard for that to happen, but there also has to be almost a language library of words and phrases, which in Ireland can be challenging given the different accents and in the States as well, you know, the different areas and the different colloquialisms that can be used. But I actually think in terms of trends and what it can provide, there's always going to be that kind of hands-on approach. Even if you are using speech analytics, there still needs to be the analysts who will actually spot check and see the ones that are having difficulty. Is it actually a true deduction of mark, or is it an inability to capture? The one thing, and I can tell you, speech analytics has come a huge way. I've been monitoring it and checking into it now since 2016. But the strides that have been made in terms of successful automation has been really, really interesting. But it's mostly based on words and phrases. There's still no sentiment. You're looking at language again, which is why language is so important. And volume, you know, if somebody's shouting down the phone. But to my mind, you still need almost that concierge approach to be able to go in and capture and trend. Quality assurance team is responsible for completing the evaluations, but also providing to operations actionable items that they can then take back and work on with their team for improvement.
Yeah, most definitely. Most definitely. It's that full circle approach that's so important. So important. And you mentioned something that's really interesting there, Mary, in terms of AI could bring great benefits, as you mentioned, in terms of being able to identify certain trends across all areas. But having a team of experts there to provide that full circle picture for the team is going to be absolutely vital.
It really informs the business, which is crucial in any business. It doesn't matter whether it's healthcare or something different.
Yeah, fully agreed. Fully agreed, Mary. Thank you so much for that. Look, I know we're coming towards the end of our time here today. So we wanted to open the floor to any questions that have come through. So some have been coming across here during the time that we've been speaking with Mary. So Mary, if you don't mind, I'm actually going to rely on you a bit further because these questions
go ahead.
are more in line with your expertise than my own. So first question that has come through to us here that we wanted to highlight is, when you're recruiting, what do you prioritize in a patient service representative? Is it those hard skills? Is it that bit of emotional balance, or is it a mixture of both?
It's definitely a mixture of both. You know, you can have somebody who is great at engaging. You can actually see it when you interact with them. They're a very positive person. But if they haven't got the hard skills, you're storing up a whole wealth of hurt for yourself. Because what's going to happen is if they keep scheduling incorrectly, the clinic feedback, the provider feedback is going to be negative. And what's happened with a lot of healthcare systems, let me just say quickly, is that a lot of the scheduling has moved towards centralized scheduling, where you've got quite big contact centers with different specialties being scheduled by different teams, which means the control to a certain extent has been taken out of the clinic. They will have the ability for, say, an overbook, or if there is availability, then the scheduler can actually liaise with the clinic and arrange to get an urgent patient in or put them to the nurse triage team or whatever. But effectively, the provider has essentially lost control of his schedule, which most of them are not happy about, because they used to be able to go out to Nancy at 2 o'clock on a Tuesday afternoon and say, clear my schedule, I'm going to play golf. They can't do that anymore because, well, in most hospital systems, because the pressure is on with the impact that COVID had in terms of revenue, the pressure is on to utilize the schedule for all providers, that they're seeing X amount of patients, whatever the time slots are, whether it's 15 minutes or 20 minutes or 30 minutes or whatever. So it is actually really important that the providers are happy, that it's not a pain point or a roadblock at the clinics. Having that combination, I know it seems like I kind of went on a tangent and I did a little bit, but it's the combination of both those skill sets together that's actually going to give you the optimum representative.
Yeah, very interesting. We had a similar question coming in terms of when recruiting. If you had some candidates who did have one or the other, they had the hard skills, they had the emotional intelligence, do you feel it's an area where you could recruit them and coach them up and train them up on, the emotional intelligence, let's say, or would you need to see evidence of both before making that decision to recruit a candidate?
It's very difficult because you're looking at this snapshot where you're seeing them through assessment, through interview. Sometimes you get a really good gut feeling and think, yes, they have great potential. Also, really closely examining the resume. Did they job hop a lot? What kind of work they're doing? Is it related? Do they have the necessary skills? There is nothing to a certain extent that you can teach. It's their ability to absorb it. Are they going to take it on board? And sometimes, you go with your gut and you hire them and you try it and it doesn't work out. It's just the law of averages. There's no hard and fast method to get the perfect representative. It requires intuition to a certain extent, an ability for hard skills, how they interact, their level of engagement, and what you're likely going to need to provide to them afterwards in terms of physical training, coaching, communication, soft skills. We do one called a Contact Center 101, how to communicate at work, the environment of the contact center, what the ideal is, and we train accordingly with that.
Brilliant. And I guess just one quick last one, quick question that we can squeeze in here is, what do you recommend for managers to provide the right emotional support for PSRs?
Get to know your PSR. The monthly one-to-one will facilitate that. You don't want them come crying to you every second of the day, but by actually getting to know them, you actually get to identify what their strengths or weaknesses are, and you can actually tailor your approach accordingly. There isn't one person alive that I don't think likes to be acknowledged at some point for something that they've done well, which is why the delivery of the message during any engagement should be, you've done this great, however, we need to focus on this. In the monthly one-to-one is actually saying to them, what do you think you can do better to improve? It's actually putting the onus and the ownership back on them. It's letting them know that they are supported through good times and bad times. in that
Yeah.
there's a sense of fairness right across the board. The engagement is crucial.
Couldn't agree more. Couldn't agree more, Marion. Look, I know we're coming up to the hour. Mary, could speak to you for another hour if we had the time. Thank you so much for your time today. It has been insightful, interesting, and yeah, so some really great takeaways for myself and the audience. Thank you very much for your time.
My pleasure, and thanks to you both, and thanks to the attendees for listening to me for an hour.
I'm sure they were as happy as I was to listen to your views on the topics that we discussed today. And we are upon the hour, so I don't keep anybody for too long. Before we go, I'd like to thank, of course, Mary May for her time again. It's been brilliant. I'm sure you'll all agree. And thank you to Mariana, who's the person who got to organise this whole thing and put it together and kept us on track here. So thank you very much. And most importantly, thank you to everybody who's joined in to listen to us today. Yeah, we hope to see you back here for the next webinar.
Sounds good. Thank you, everyone. Take care.
Thanks,
Bye.
everybody.